The subject of the presentation was about the patient compliance or adherence. That means how often do the patients in reality take the medications they are supposed to take and how often they don't. And it was also about factors driving that adherence. So which are the factors making patient more compliant or less compliant and what we could do about. The take-home message number one is patients are generally not well compliant. 50% of the patients don't take the medication regularly and only a minority is taking them very exactly. And the second take-home message is that patients don't easily tell that they don't take the medication. It requires some skills from the ophthalmologist to get the patient telling him the truth. For instance, to create a safe environment, suggesting the patient it is fine to admit that he doesn't take the medication always as he should. And also another important take-home message is that the easier the medication regime, the fewer time points a patient has to apply medication, the easier it is for the patient to comply with the medication and the more likely it is. And the final take-home message is that we have quite good proof that a patient not taking his medication regularly has a much higher risk of getting blind, or vice versa. Patients with more severe glaucoma have a much higher likelihood of being non-compliant. So this is the set of recommendations to have open questions to address the patient like in a way like, yes, it's okay if you don't take the medication. We know that it's difficult to take it. What is your problem with the medication? And then see how to work about that.